Hi, my name's Morgan Gott, and I did my project on fall prevention. For my practicum review, I did my clinical rotation at Eastern State Hospital. I followed around a BSN nurse in admissions. I was familiar with how things worked on the unit side. I was not familiar, however, with how things worked in admissions. Learning all the legal side of what criteria a patient has to meet in order to be admitted. Some see a QMHP, some go straight to the physician. Some patients get admitted depending on what type of court order they're on or what county they're from without being evaluated by a QMHP at our facility. After learning all the legal side and how to submit all the legal paperwork before you even bring someone up to the admissions suite, I then learned how to assess a patient. All the full physical assessments, psychosocial, everything is done in admissions instead of on the units. You put together the chart, you give reporting to the physician. It was really nice to see that part of the hospital that I actually work at. I decided to do my project on fall prevention through identification of fall risk factors and early fall prevention interventions and admissions. I created a 5-question pre-test and post-test and administered a fact sheet about falls to employees to see if their score would improve with an education sheet. I know we get trainings and the hospital is up to date, all the employees are with current fall preventions, but it's nice if you're, reminded about those things. My learning goal was to understand the risk factors for falls, understand how they can be prevented, and assess whether an intervention is effective. Is the educational handout effective in preventing falls? So my plan was to create a fact sheet for employees and identify the risk factors for falls, test their knowledge with a 5-question pre-test and post-test, continue to implement the hospital practices, and assess whether the fall numbers decreased. My learning objectives were met. I accomplished this goal by creating a fact sheet. Staff members in admissions understood the risk factors for falls and the importance of recognizing a falls risk in the initial nursing assessment. Admission staff also recognized the importance of communicating patient fall risk when transferring the patient to their assigned unit and how falls are prevented. There were no falls in admissions while I was doing my clinical rotation. However, falls among the units remained consistent. There were no increase or decrease with the falls among the units. Also, I didn't hand out my fact sheet to the units. I just focused on admissions. Our practicum hours weren't long enough to really implement this study within the whole hospital. So if I could have had a longer time period and had more people participate, since I really saw the same people in admissions, I think this would be a pretty cool study. Since I work at Eastern State, I think I may try and just do it by myself and see what the results are.